9 out of 10 NHS trusts say their hospitals have been at unsafe levels of overcrowding. 9 out of 10. We're seeing patients dying on hospital trolleys as they wait for treatment. Despite an ageing population and increasing costs of treatment, NHS funding, no matter what this government would have you believe, is growing at its lowest rate since records began in 1955. Only recently we saw reports that 19 NHS hospitals actually face closure. 19 hospitals. The NHS is something we can all be proud of, every one of us. Healthcare for everyone based on need and not the ability to pay. Healthcare that's free for all, everyone at the point of use. But right now today, the NHS is facing a crisis in morale, a crisis in funding and in staffing, and social and mental health services are literally at the point of imminent collapse. We've seen an unprecedented rise in mortality in England and Wales, which is likely to be linked to cuts to the NHS and social care budgets. And we're talking about 30,000 excess deaths in 2015 alone. The majority were old age pensioners, real people like our mothers and our fathers and our grandparents. The most vulnerable, first to be struck down by this government's cruel and callous cuts to the NHS and social care budgets. Theresa May says she's got every confidence in her Health Secretary, Jeremy Hunt, which is staggering given he's the man responsible for the longest accident and emergency waiting time since 2004. Fewer beds and doctors than almost anywhere in the EU. And his claims of £10 billion extra funding for the NHS has been completely rubbished and proved untrue. And let's not forget, he plans a further £22 billion of cuts to local services by 2020. This is the man who scrapped bursaries for student nurses, causing a huge drop in applicants when we have a desperate shortage of nurses. And he's still railroading through an unsafe and discriminatory contract for 54,000 junior doctors, which will see them working longer hours at a time when a recent study found many of them already falling asleep at the wheels of their cars driving home. And Theresa May, she describes him as a passionate advocate for patients and doctors. It's nothing less than sheer stupidity. That this government is presiding over the destruction of our NHS on a scale that's unprecedented is beyond any doubt. The question is whether it's the result of utter incompetence and negligence on the part of the government or the result of willful neglect and defunding, so it can be handed over to private capital. I believe both, but it's clearly by design. The NHS is already broken up and being sold off bit by bit, and it's not even being done in secret. We've come together today to fight for something precious, something we all believe in passionately, and something we want to save and preserve for our children and our children's children. It's going to take a fight. It's going to take toe-to-toe slugging it out with this government, and that fight starts now.